I'm Dr. Kayser Enneking. I'm an anesthesiologist at the University of Florida. I've been in that position for almost 30 years. It's hard to think of somebody who's had one job the whole time. And over my lifetime, I have watched our healthcare system get more and more fragmented and have watched it become more and more difficult for patients to access good healthcare. As an anesthesiologist, I oftentimes see patients sort of at the end of a journey to actually come to the operating room. And so I oftentimes see that struggle that patients have for getting health care. It wasn't that long ago that I was assigned to take care of a room where we had 3 patients who were going to have breast cancer surgery in one day. The first patient was a young lady who had a very small biopsy. She had good insurance. It had been caught early. It was she was in and out of there as a day-stay patient. The next one was an older lady who had Medicare, and she had also gotten her mammogram done through Medicare. And she had a little bit bigger operation, but was in the hospital for just one night, because again, her disease had been caught at a very early stage. But the last patient that we took care of that day just broke my heart. She had to come in through our emergency room, and she had what we call a fungating lesion coming from her breast. That means that the cancer had broken through her skin and had created a weeping mess in her breast. So she'd had to be admitted to the hospital. She'd gotten antibiotics for 2 days before she came to the operating room and had to have the entire breast taken off. She ended up in the hospital for about 4 days after surgery, and all of that was because she couldn't get a mammogram. She could not get access to healthcare short of coming to the emergency room when she had a real emergency. Most heartbreaking is that her prognosis will be severely impacted by that. So her likelihood of being alive a year afterwards was determined only by the fact that she didn't have access to healthcare. At this point in time, there's just absolutely no excuse for us not to do this. If you can't afford to see a doctor, you can't afford to have a mammogram ordered, you can't afford to have your blood sugar tested, you can't afford to have an EKG done. We have almost 1 million people in the state of Florida that are either underinsured or have no insurance at all and have no hope of getting insurance. So we call those people that they are in the gap. So they make too much money to be strictly given Medicaid, and they don't make enough money to qualify for the Affordable Care Act marketplaces. They have no hope of gaining access to medical care. And those are the patients that I truly feel somebody must stand up and advocate for. 70% of those people work. They are people you see every day. They work hard, they take care of their family, and they are just one $500 bill away from disaster. And it shouldn't be for getting medical care. Physicians have a unique place in our society. They are trusted. They all have a scientific background, and they are all frustrated. They are frustrated by their inability to fix all of the things around healthcare that make their patients unhealthy. The lack of access to medical care because of a thing like lack of insurance, because Medicaid hasn't been expanded, seems like something we should be able to own. We see the outcomes on a daily basis. We feel it when we take care of patients. And we should be able to and must stand up and take a stance on this, because this isn't about dollars and cents. This is about people. And this is about making sure that people have access to health care. I will say, on the flip side, it is about dollars and cents. And it makes every bit of fiscal sense for Florida to expand Medicaid. on every state that has expanded Medicaid, they've had a positive economic impact. Let that kind of roll around in your head just a little bit. Every state that has expanded Medicaid has had a positive economic impact. There's not a debate about whether Medicaid expansion works. Virtually every medical and economic outcome that you look at favor those states where Medicaid has been expanded. And if you're one of those people that thinks Medicaid expansion doesn't really, impact you, let me just tell you, if you have insurance, that your premiums go down by 7% when a state passes Medicaid expansion. So the moral high road, the fiscal high road, the right thing to do, the medical high road is that we must expand Medicaid.